I hope everyone who has joined today has basic concepts of what an EMR is and what an open EMR is. Even if that is not the case, I will quickly brief you. So EMR is electronic medical records in very simple terms. It's a tool for hospitals, clinics, physicians to maintain and review and analyze patient data. And nowadays it is more of a complex architecture and a complex platform, which the providers use for various things, from monitoring patient data to submitting claims to reimbursements, all of that. So let's go ahead and let's discuss the agenda. So the agenda we'll have is a basic introduction. Then we have EHR adoption and the cost landscape, just a general overview of what the landscape currently looks like. Then what is the business case for an open EMR enterprise solution. Then we have case studies and ROI insights. Then we have modern architecture and data migration, how that is handled. Then we have implementation and change management, and then we'll have some use cases and scalability discussions. So without further ado, let's go ahead and jump into the introduction. So, as I said, I'll just read through the agenda and then I'll explain what we are here to discuss. So today's session is titled From OpenEMR to Enterprise Grade EHR, your multi-million-dollar optimization plan. This isn't just about switching system, it's about a strategic, financial, and technical transformation that drives both cost efficiency and significantly improves patient care across a large organization. We are going to explore how a free open source platform like OpenEMR can be engineered and optimized into a robust enterprise grade system. Our agenda is designed to move you from why to the how of this major undertaking. We'll cover the current cost landscape, dive deep into the financial business case, ROI, discuss technical migration and essential change management, and look at some practical cases of scalability. So let's get going on that end. So as I was saying earlier, OpenEMR is a open source free to use platform, as you all might be aware. So today we are essentially going to discuss how we take this free open source tool and convert it into a potential multi-million-dollar solution. At CapMinds, we do have a lot of our clients who have used this and who have grown into enterprise level architecture, and they're still using the system. So that proves the efficiency and scalability of the system. And let's just see how it can be adopted and what does the current landscape look like, which is the next agenda on our menu. So currently we have about 96% of US hospital, or almost everybody. I don't think any hospital, any major hospital in a major area or almost across US, they have some sort of a EHR system. I don't think the pen and paper is being used anywhere in the States. So with the High Tech Act and everything coming in, almost all clinicians, all practices, all hospitals have a EHR system. So let's get this out of the way. Then we have, how about OpenEMR? How many providers use OpenEMR? To answer that question, we have about 100,000, or I would say around 150K. This data is a little bit, I would say, outdated. We have about 150K providers across the globe who are using OpenEMR. Out of this, I would say about 75 to 80% of this traffic is from US, and around 200 million patients have had their records in OpenEMR. So this is not a new system. This has been, the initiative was started in 2008 after the Obamacare, and then it has been going on strong since. Then let's see how many countries have this. Almost all countries have downloaded OpenEMR. This data is visible on their community forum as well. So this is one of the most widely used, globally adopted system for patient management. Now moving on. So why are we talking about, turning the free open source into a multi-million-dollar system? Is because I would say US practices, US hospitals specifically spend a absurd amount of their capital on EHR. So it's about time there is a open source system that comes in and that you don't have to spend a lot to customize and essentially do the same functions that all the major EHR systems do. So roughly we are seeing, even if it's like I would say about 15 to 20 provider hospital, they are spending upwards of 50K, 60K a year just for licensing for something that they cannot use. So that's something that we are going to talk about, how OpenEMR comes in and solves this problem. So we often forget the hidden costs also. There is training, there is implementation that goes to around 15 to 25% of the fees for annual maintenance, and that requires a lot of time. So the stakes are enormous here, and I'll show you a chart of how major proprietary implementations at large US hospital can range from from a few $1 million to upwards of hundreds of $1 million if it's like a national chain or something. So this highlights why there is a decision to optimize and scale your existing open source foundational to a critical financial decision. So why it's a business case, why it's a multi-million-dollar investment here. Let's jump into that. So, this is basically for your executive team if they want to look at it. And, we are going to see two cases here. One is a TCO reality check, then we have why it is good for enterprise. So, OpenEMR's base cost is low. So an enterprise, great investment demands some answers. So how it's how it can be customized and what's the professional support look like, why what is the security and compliance structure looking like, how it's scalable and high availability infrastructure. So what you are investing here, basically I'll walk you through that. Then how it is for how it is set up for enterprise level clients. So it how it can be scaled, how it's integrated, how it's mitigating risk. So to when you're investing in OpenEMR, you're essentially investing in a couple of things. So adding on to the slide. So OpenEMR, as I said, it's a free to use software, so anyone can just download it and plug and play. But when it's coming to how do we set it up for a enterprise level solution, there are a couple of things as it's mentioned here. So the base OpenEMR has basics functionalities nailed down from your patient scheduling to your reporting. But when it comes to setting it up for 200 users, 300 users, we have to make sure that every customization that we do that has a level of finish, a level of polish that allows the system to be up and running, and almost every 200, 300 users have the same experience across board. And another major thing that we have to make sure, although OpenEMR is 100% HIPAA compliant, we have to make sure that when we are implementing it, it has all the security infrastructure set up. And we also have to make sure that, whatever we are setting up, it has to be scalable. So if we are going from 300 to 500 users, we have to make sure that the system is highly available, it doesn't lag, and it works as any proprietary subscription-based EHR system. So this is the business case on why you should invest in OpenEMR if you are an enterprise level client. Then moving on, we have some case studies and ROI insights. Before jumping into that, let me give you a little bit of a background. At CapMinds, we have been in business since 2008, since the initiative, but we have seen a boom, I would say, from 2018, 2019 into OpenEMR. And since then, we have worked on different types of clients from small, medium, large enterprise, or even at a federal level, we have implemented OpenEMR. So we just wanted to give you some case studies and return on investments, how it has looked like for some of our clients. And some of these clients I have personally handled. So I have that expertise coming into this as well. So let's look at some of the major OpenEMR clients here. So there is a Samsung Medical Center, and their present value is around $3.6 million, and it paid back, the system basically paid back all of that within 6 years. So the ROI insight here is that the strategic EHR investment, it yielded a measurable financial return. Then we have a urban hospital that we added one EHR function there, which saved around 0.14% of their operating costs. Considering the size, it was a huge efficiency gain across enterprise levels. Then we have industry-wide analysis. Across the industry, if we have to make a rough estimate, it's saving around 78 to 81 billion dollars with regards to the fees that would have gone to a subscription-based, license-based EHR system. So this is just some use cases. Then we're talking about for full EHR migrations. In migration also, since it's open source, the migration is not very complicated. It just requires a little bit of a planning and a little bit of a making sure that the script is 100% done, and then it saves a lot of time. These are just rough estimates that we have put together here, but when we jump into some live use cases, you guys will understand how we are saving a lot of money to our clients and time as well by implementing an open EMR based solution. So we have some case studies here as we are talking about. So these are just some of the customizations which we have done. So one of our major requirements, or when we talk to clients, comes in terms of integration with immunization registries or integration with immunization forms. So here you are seeing an example of immunization form which we have customized for one of our clients. So here you can see that there's a lot number available. Let me just zoom in here a little bit. So here you can see the information source, you can see the stock of that particular immunization vaccine, and here you can see the completion status and everything. And the best thing is, in US we have multiple immunization registries for each state. Essentially, it has a different immunization registry, and with all of them, we do have integration pipelines which pulls in the data from those, and you can see the lot and the FAC number for that particular immunization vaccine. Now, going forward, this is just a sample of how the backend looks like and how we work on a particular registry. So here you can see the PHP file on what we have worked on, how it looks like in the backend. Then this is the inventory, which we pull directly from the registry. So you can see how many lots were allotted for this particular client. You can see, this is specifically for the COVID-19 injection, which you can see here, which we worked during that year. It was very critical to work on solutions like this. So here you can see how we add a lot, and then we, query the registry, and we see the live updates of that particular lot here. Now moving forward, this is just related to the immunization. Here you can see how we can update a lot, how you can see how the destroyed drugs come in here. If they expire or for any reason they were destroyed, you can see those here as well. Now you can see the report of those immunizations. So this gives you a complete understanding of when we work on a customization, what kind of detail level we go in. So the requirement can either come from the client, or we can do a little bit of a discovery and we can build this complete workflow. So this workflow doesn't exist in base OpenEMR. So when we customize it, this is how essentially it looks like. Now moving forward, this is the immunization inventory. Then we have the inventory list, all immunizations, all of that data. Then one of the major customization requests that we get from our clients is to customize an encounter form. So you might be in any kind of a specialty. For example, if you're a neurologist, if you're an ophthalmologist, you have different encounter note requirements. So those requirements you can, come up with. Let's say you have a specific way of writing notes. So almost all major EHRs will not give you the ability to customize it in exactly the workflow that you have in mind. But with OpenEMR, since it's open source, you can essentially customize it to work exactly the way you like. So for an example, we have the SOAP note here, and the level of customization that we can do here is essentially, infinite basically. So, for example, for a SOAP note, if you want to pull in the patient details, let's say the patient name, their age, and their date of birth, you can just click on the left hand side and you can just drag and drop it into the SOAP note, and it will work seamlessly from there. Then here you can see their allergies. So here you can see the date, the detail pulled in here. Then you can see their allergies if you want to pull that in, and you can see their lab order. All of that history can be pulled in directly from here. So any level of customization you want on the encounter side of things, it's possible with OpenEMR. That makes it one of the widely used system and quite effective when it's used. Then moving forward, on the assessment end also, if you have a particular template, so basically you don't have to do a lot of writing. So this was done for one of our clients, I believe, who has around 5 or 6 clinics, and almost all of them are using this template, not just on the SOAP but on other forms as well. So basically it's a drag and drop system. You don't have to do a lot of writing. All of the details can be pulled from the side and be put into the system here. Now, moving forward, this is just more examples on the SOAP note. And if you guys want this copy of the slider, do let me know in the comments, and I'll go ahead and I'll put that across to you guys as well. Then moving forward, let me just zoom out here. Now, this is another critical area when it comes to any kind of open source system, how we can customize it for security. So one of the major security implementations can be in the form of SSO, which is single sign-on. So, making sure that you can integrate it with Microsoft Outlook, you can integrate it with Gmail. We do have that capability, and this is an OpenEMR system for which, this is built for a public health client, and then we have just implemented SSO here. So it has that layer of security that any other system has, and so we don't lag in that department as well. Moving forward, we have some other customizations which you can see. We have some scheduling customizations with regards to different specialities, different providers. So essentially anything that you can think of with regards to, customization, and we can go ahead and we can build that for you guys. Now, moving forward, we do have a major challenge here. As you're looking at these screens, this doesn't look very, what I would say, this doesn't look very modern. So how do we solve that? Essentially, since we have a lot of experience with the system, what we do is one of two solutions. One is we layer a entirely new JavaScript-based screen system, and then we integrate it with the OpenEMR functionalities. So this is one of our platforms called Wozo. If you want to check it out, you can check it out at wozohealth.com. This was built in a way, we layered a screen on top of it, and then we are able to get this modern, chic look, depending on the client's requirement, or in this case, we built it for ourselves. So, that problem is also solved using this solution. Now, moving forward, these are just some UI screen examples. Then what about the architecture and data migration? So let's say you have been using Epic for about 10 years now, and how do you, when you plan to do this OpenEMR, it becomes this behemoth task of, migrating the data from that particular system to data migration. So let's see how we solve that as well. So, talking about the technical roadmap, let's see the architecture and data. So the technical foundation of an enterprise system must be designed for scalability and reliability that we discussed earlier in the webinar. This means moving away from a single server setup and designing a cloud native infrastructure for high availability and disaster recovery capabilities built from day one. Now, next is interoperability. So how the EHR system is able to communicate, let's say, with your blood pressure monitoring machine or with your ICU ventilation beds, how it communicates with that. So it must integrate, seamlessly integrate using APIs, FL7, FHIR, HL7, and all of these modern technologies. So we resolve that because OpenEMR also has a system which is called Open APIs. So it basically allows you to integrate with any third-party system out there. So it can be Availity for your clearinghouse requirements. It can be Omron for your, vitals monitoring devices. It can be your Apple Watch even, or your Google Fit even, to monitor the patient's current data. So that's how we resolve the interoperability part. And with regards to data migration, what we do is we have a MCVM strategy, which is we map all the legacy data that we get from the previous EHR with the OpenEMR data fields. Then we cleanse it, basically meaning that we fix any inconsistencies, remove any duplicates, and make sure that the data is accurate. Then we validate. We test data integrity into a controlled environment, making sure that, before the complete migration, that particular set is 100% clear. Then we migrate the data. Usually I would say for a mid-level clients, it takes about 1 week to 2 weeks. For an enterprise client, which has, 10 years, 15 years worth of data, it might take about a month, month and a half, but it shouldn't take longer than that. Now moving forward, what does the implementation and change management look like? What does that process entail? So, a multi-million dollar project, when we are talking about, especially on this scale, it's determined by its people and processes. So whenever we are working on a project like this, we make sure that we have rigorous planning. We have, the client or ourselves, we have sufficient budget. We have the scope, clinical and administrative stakeholders all spoken about, all the requirements gathered, and then we have governance on top of it to make sure that everything is deployed in a systemic manner. Then, when we do the discovery, we map out the scope, the necessary customizations, the modules, workflows, all of that. And then, we make sure that everything is tested before it goes live. So how do we, talking about change management. So change management is important for any software cycle. So how do we make sure that any change that we are making, it involves the people who are involved in that? So we make sure that we have comprehensive role-based user training once the system goes live, and we address all the physician and staff resistance for demonstrating how the new system works in. So you don't have to worry about doing that from a management point of view. And we continuously measure user satisfaction for the first couple of months to make sure that everything is up to date and up to user usage here. Moving forward, we have use cases and scalability. We spoke about this earlier, but we can touch base on it again as well. So when we're talking about enterprise grade OpenEMR, who it is flexible for. It's flexible for multi-site hospitals. It's flexible for community health centers. It's flexible for specialty practices and research because it gives them custom modules and advanced analytics tools. Then it's even flexible for remote care. We have one of the largest RPM clients in the States, so OpenEMR has been tested there as well. Now moving forward, community and support. So how does the OpenEMR, let's say you are a simple user and you just want to use the base OpenEMR, you can find all the answers related to installation, to customization, everything, the ONC, HIPAA standards, everything within the OpenEMR community itself. It has about 100,000 providers, as we were talking about earlier, and I would say about, 5,000, 6,000 users are always live on the OpenEMR community page to answer your questions on that end. So, you also get transparency in the code base, you get vendor independence. So it doesn't have to be just us. Let's say you want to go with another vendor, you can go ahead and you can do that as well. So you have collective security and problem solving. So this is a very unique case in that regards. So I just wanted to say all of you thank you for taking the time. The session has been about 25-26 minutes as we expected. As I mentioned, I'm the business slash accounts manager for Capminds. You can reach out to, help at capminds.com or www.capminds.com. But I would suggest you can reach out to me directly as well. My email is said@capminds.com, and I will be more than happy to answer your queries there. Or if you can leave comments from this session, and I'll be more than happy to answer those as well. So yeah, thank you so much.